Hi friends, I am Dr. Rohit Udaya Prasad, Lead and Senior Consultant for ENT and Cochlear Implants at KIMS Hospitals, Electronic City, Bengaluru. Today we are going to discuss something about cochlear implants. Cochlear implants are bionic devices which are implanted onto the skull bone, and an electrode or a wire which conducts electrical impulses is placed inside the cochlea. There is an external device which connects via magnet onto the implant and helps to transfer the external sound to the device inside. This device helps to convert these sound signals from externally to electrical impulses and transfer it to the auditory nerve. Cochlear implants are done for people who have severe to profound hearing loss. It can be as young as 8 months old. It can be as old as 70 or 80 years old. Congenital deafness is basically children born with hearing loss. They benefit maximally with cochlear implant surgery if done before the age of 18 months. Ideally, you can start implanting them in both ears from the age of 9 months. The earlier you implant, the better they hear and the better is the speech outcome. In adults and elderly people who have hearing loss which is severe to profound or have very low speech discrimination score, cochlear implants are also ideal to be done in them, which enable us to get better hearing and definitely better quality of life. Do not hesitate to reach out to us when you have these issues in your own family or you yourself face these issues. Thank you.